Good afternoon, everyone, or good morning if you're over in the US. Running a minute or so behind. So as we're just waiting for other attendees to join, I've got a little surprise for you in the chat. Just a little friendly poem we've been working on. So I thought we'd give you 30 seconds of reading time in the chat there as we wait for attendees to join. If you were with us last week, we made a joke about singing a song, and I knew you wouldn't want that, so I worked on a poem instead. But thank you all for joining, and we'll kick off the session in a minute or so. We're getting some reactions to the poem already. Positive reactions, luckily. If anyone has any of their own poems they'd like to share in the chat, you're more than welcome to. They don't have to be control charts related. Just give it another minute or so for everyone to join. As you are joining as well, we did this last week for anyone who wasn't attending last week, but we have got a number of registered attendees for quite a few different countries actually, mainly the US and UK. But if you are able to share what location you're from, that would be nice to see as well, just so we can see how many of the attendees are currently in the US, UK, or anywhere else. I'll get started then. As you may be able to tell from my accent, we've got UK's winning. Hi, Erin. Good to see you there. Hi, Andrea. Okay. So, if it's okay with everyone, we will get started. So, again, thanks everyone for joining the second of our three-part series of this webinar with Cincinnati Children's Hospital. So, as we mentioned last time, we've been working with Sherry and the team at Cincinnati for just over 12 months now, supporting them on their Power Platform and EasySPC journey. For those of you who are not familiar with BCN, we're a digital transformation specialist based in the UK, and part of what we do is support healthcare organisations with their data and reporting needs. So in the last webinar episode, Blair and Marianne were sharing a little bit about why they use control charts, and going into a bit more detail there as well. And in today's session, the Cincinnati team, primarily Sherry, will be sharing a little bit about how they are using control charts with the different tools which are available to Cincinnati Children's in their ecosystem. In the chat, we do encourage you to ask questions as we go along as well. So if you've got any questions for Sherry, Marianne, Blair, myself, or just a general discussion point for anyone else in the chat that you'd like to enter, please do that. We'd love to see this as a bit of a discussion forum too. We don't want you just listening to us, but also partaking as well. That'd be great. And also, we have a quick poll, which we're just going to kick off the session with as well, which should be entering your chat any second now, because I did use my prompt of poll, and there it is. Thank you, Matt. So if you were all kind enough to submit your answers to this quick poll question, that'd be great. And in the meantime, I can see that Sherry has already shared her screen. So over to Sherry and the Cincinnati team. And I will go mute. Thank you.
So I think Marianne, you're gonna kick us off, right?
Yeah. Hi everyone. Happy to be here with you again from last week. So our second webinar, we'll take a deep dive into the implementation process. We'll talk about how we at Cincinnati Children's customized EasySPC to meet our needs. And you're going to follow our journey a little bit as we've been overcoming some implementation challenges. We've been integrating EasySPC with our existing systems, and we're navigating the complexities of training and change management. And we will also showcase some real-world outcomes and the impact on healthcare quality. So just a little refresher about what quality excellence is to us at Cincinnati Children's. We have our domain and infrastructure leaders that work collaboratively across our system to develop, support, and manage world-class quality that aligns with the achievement of our mission. And so again, those quality domains are access, safety for both employees and patients, experience as a wellness perspective for our employees, and patient family experience for those that come for our services, and then achieving the best outcomes for kids. Blair, Sherry, and I are quality excellence leaders for infrastructure, and we manage the teams of data analysts, data scientists, QI professionals, and project staff that support the improvement efforts in the medical center. Okay, so how are we doing as infrastructure leaders? A little checklist. Have we developed world-class quality? Absolutely. We have, our Leadership Academy is full of a QI portfolio of courses that have amazing QI curriculum with nearly 90% of all graduates getting real improvement results. So we feel great about that capability. How are we doing in supporting that world-class quality? You betcha. We have a good-sized team of talented QI, data, and project management professionals that help support the amazing work we do at Cincinnati Children's. And third, how are we doing at managing that world-class quality? Yes-ish, we're not ready to check this box yet. We are experiencing challenges here, and actually Sherry's going to go into some of that a little bit more, but currently we're undergoing an organizational restructuring that supports operational excellence as we've outgrown our old structure. So we needed to have that structural change. The new site of care leaders that we have and the quality domain leaders are partnering to develop our 5-year strategic plan goals, and that's happening this fall. As leaders in this new structure, we're learning how to work across the system. And our data and visualization support tools, along with more collaborative data-driven decision-making, is what we're learning our way into now. Sherry's going to talk more about some of our operational challenges.
Yes, so the Anderson Center has our many resources across the entire organization, and foundationally, each of the teams was using QI methodology in a standard way. So we were creating key driver diagrams, we were testing and measuring interventions, all of those proven fundamentals. Those were solidly in place. But each of these teams were operationally autonomous of one another, which means they were using their own methods to organize and share the work. They were siloing themselves essentially, and answering simple questions like how many projects do we have right now was far more challenging than it really should have been. And the result was, I'm sure you know what siloed work looks like. You don't have a tremendous amount of insight to the work that's happening across the system. There's no system view. So this is also commonly referred to as a black box. And whatever you call it, operating this way meant little to no insight to how we were performing across the system, and updates to our organizational leaders required a considerable amount of manual lift. And additionally, we were noticing more and more variation in the way that data was being displayed. And our charting standards were not consistently being followed, and sometimes there wasn't even an SPC chart to be found. So, I advanced, unfortunately. So, apologies there, my system advanced without me. So the important evaluation of SPC charts is really to know how is your process doing, right? And if you're not visualizing them accordingly, how do you answer that question? How do we know that the change was an improvement ultimately? So moving into selecting and customizing EasySPC, we wanted to help. That's one of the problems. There were many problems that we were solving for, and one of those was SPC. You know, how do we, in a standard way, even more of a standard way, we have templates, etc. How do we better support the organization? I'm not going to use that same advance that I did earlier. So you may recall last week we had asked the question, what additional topics would you like us to discuss during the webinar series? And Power Platform was the #1 response that we received, which actually it was humorous because that could be its own webinar series. It's pretty broad, right? So full disclosure, additionally, I'm happy to talk about this a little bit, but I would not consider us the experts on the subject, considering this is relatively new for CCHMC. But we have learned a ton already on our journey, and we're happy to share the knowledge that we have gained. So feel free to pass any questions you may have about Power Platform into the chat, but I will be speaking specifically to its relationship with EasySPC today. All right, so I'm sure most of you know that EasySPC is a Microsoft certified Power BI custom visual that enables you to create SPC charts. I took that right out of your brochure. And Power BI is only one component of the entire suite of tools, and these are designed to work seamlessly with one another. So, like I said, I'm going to focus on EasySPC and I'm going to focus on Power BI for the purpose of this webinar. But when we move into next week, we are going to touch a little bit on the other tools in the Power Platform suite that we are using here at Cincinnati Children's. All right. So I'm going to give a little bit of history on how we as an organization came to start using this tool. And back in 2020, Cincinnati Children's launched a multi-year organizational digital transformation strategy. And roughly 2 years into this transformation, Power BI was identified as the preferred data visualization tool for CCHMC. So that meant a really pretty big undertaking. We had enterprise reports in place, but they were using different visualization tools. So the organization demonstrated their commitment to this product as an enterprise solution through the purchase of premium capacity licenses. And we've begun to transfer and migrate existing reports from whatever visualization tool we were using previously now to Power BI. So relatively recently, we did get that premium capacity licensing in place. And this was a game changer, really. It allowed us to share reports at a pace and a scale we've really only ever dreamed of. And for large organizations such as ours, publishing to a premium capacity workspace gave 18,000 employees immediate access without requiring additional licensure. So for those of you in the audience just getting started, I do want to really impress upon you that this is not required. Don't be discouraged, because this, of course, is costly. This is like the Cadillac of licenses. But you can get started building reports using Power BI Desktop and publish to your personal workspace, and that's free of cost. So you can really start to dig in and familiarize yourself with the tools without requiring additional licensing. So armed with Power BI and the right level of licensing for the size of our organization, we now had the daunting task of really standing up SPC charts and a new visualization tool. And that's really what the next step was once we identified we're going to move forward. So I'm not sure if all of you have seen calculations behind control charts, and that's what's bouncing into view here. And if you haven't seen these, my sincerest apologies for the headache that may be induced. But for the Professor X's in the audience, reading these cards may be as easy as reading green eggs and ham, right? But for many in the audience, and I'm one of those, your reaction is this, right? I thought I was a relatively intelligent person until I started working for the Anderson Center and the data scientists that work here. They are remarkably intelligent and talented. So thankfully, we had a real life Professor X. And if you're in the audience, you know who you are. And he sent us on the breadcrumb trail to BCN and EasySPC. So it made this transformation so much easier for our team. So out of the gate, we're going to touch on some customization tips now. So we've chosen EasySPC, and we were blown away right away. And knowing as an organization we were moving in the direction of Power BI through the digital transformation efforts, it was pretty much a no-brainer to purchase a license. And that meant now we needed to figure out how are we going to use this, how are we going to most effectively use this tool and scale it not only within our team, but across the organization. So the first thing that we did was take a look at and evaluate our own. We have a set of data display and charting expectations in the visualizations that we produce. And we teach these standards in our QI course offerings and have incorporated them into various chart templates, which are generally available to the entire organization. Our first step was to evaluate EasySPC formatting options with the goal of producing a visual with high degree of familiarity, right? So we didn't want to just rip the Band-Aid off. People would panic. So a few options were presented to AC leadership for consideration. So we put together a couple of mock charts and we distributed those to key leaders within the Anderson Center and got some feedback. And this is ultimately the first pass that we landed at. And if you're familiar with EasySPC as a product, one of its key features that they really heavily market is to highlight special cause. And it appears as if we've turned these rules off. And in actuality, the rules are still applied. And it will show in the call out when you hover over a data point still. So again, if you're familiar with the product, you hover over the data point, you get a call out and it says what rules are applicable. That still applies in our standard that we've set up. We've opted to format the data color to remain the same in the circumstance of special cause. And, it might seem like we're not really leveraging the product to its fullest potential. And I honestly, I agree with that comment. That is true. But ultimately, we did this purposefully because we didn't want to. Blair put it really well the other day when we were talking about this. It's meeting us where we are right now. The organization is really accustomed to looking at our visualization and these data in the way that we have done so for many, many years. So when we introduced this to the organization, we didn't want it to be too confusing or alarming. So we do plan to revisit the special cause alert and automated color changing of those data points, but we need to test it a little bit and kind of ease our way into that before we launch it broadly. All right, so now that we have our charting format identified, we know what the settings are, we need to communicate these. And of course, we will update the data and charting standards document accordingly. That is something that we need to do, but to set these formatting options with each chart created would be a major pain in the rear, and we don't want that. So the solution is to create a JSON script. And JSON is JavaScript object notation. And basically, it's a way to get some data imported into applications like Power BI. So your preferred format settings can be defined in a JSON script. As displayed here, you can see that I hid our license key from this script in case any of you were particularly observant. So your preferred format settings can be put into the script, and then you can import it into your desktop as a theme, your report, your Power BI desktop report as a theme. And another quick tip to save you some headache, that license key that I have hidden from public view, you want to pass that in there, because if you don't do so, Oliver reminded me of this the other day, when you go to stand up a new chart and you haven't put your license key in there, you have to add the key to every single visualization. So that is also not fun. So if code writing gives you a major headache and makes your eyes crossed, you don't have to worry about that, because our friends over at BCN, they've already thought about this, and they will provide a JSON theme generator displayed here. And it is in Excel. It's a tool that most people are comfortable with. So I was very appreciative of that when they handed it over my way, and it creates the code just lickety split. So there's a no code solution, and it's fantastic. So very, very easy for the end user to get that script generated. All right. So the JSON file is generated and I can now import it into a Power BI report template. And this is also a really important consideration. And because it saves so much time for your report builders. And you can include your organization's logo, your branded color palette, have some thoughts and considerations with the standard navigation and other defaults. And ultimately having all of that already in place in a template that you can share with your report developers and others is just, it's fantastic. And our Power BI report template has a report page for this, what is showing here. It has a report page for an executive summary. There's also some pages for recommended data layouts for data over time, and then also by location. We also have an FAQ page that we're using as a standard. I would really encourage you to think about and communicate your expectations in the use of these templates. And when I say that, I mean asking yourself questions and what are the answers as far as, is this template merely a suggested guideline and starting point, or does the report builder need to stay within its design for the most part? Or maybe it depends. It depends for us. So for example, creative license is really pretty much revoked if reports are considered for enterprise consumption. But if it's a smaller project and it's a smaller team and there's not a large audience in mind, there's more flexibility with this. So you can have a little bit of creative autonomy, right? So our Power BI template has really been helpful and instrumental, and we've scaled it across the organization. So Blair was like, hey, she got so excited about it. It was cute. She was so excited, and she was like, let's share with everybody. And we have a Power BI community within the Cincinnati Children's, and we shared it there. And I don't have the results yet, but I did ask recently about just what is the reach, how many departments are using this across the organization. And there's quite a few. I mean, I think I had a pretty good response to that poll, and I'll bring that to next week's webinar, but it's been really well received and people are excited. So templates are definitely a way to go. All right, so I'm going to that's me, and I'm going to hand this over to Blair, and she's going to talk about how we've integrated this with the existing hospital systems. Stop presenting. And
all right,
there you go.
Let's see if I have control now. I think so. Hi, everyone. Afternoon, good morning. Welcome back. Excited to see this many people back on part 2 of 3. I'm so excited we got to do a trilogy. Thank you, BCN. Always wanted to be a part of a trilogy. So, okay. Here we go. A little more about how we're using it. Again, Sherry showed you the dangers of the silos, and I'm sure there are instances in your institutions that you can think about how you've experienced that as well. So again, we want to talk a little bit about more of what we've done about integrating and how we're working with existing hospital systems. But again, not just because we really like pretty control charts and things like that, but really to help the improvement in care of our patients. I'm going to see if I can advance. Oh, I'm not sure. Okay, did you click that or did I click it, Sherry?
I may have. I'll be your wingman. I'll take care of it.
I appreciate it. We'll do this. It's a team effort. All right. So across the hospitals, when we think about different ways that we want to group measures, group reports, look at different things together, we have our physical spaces, right? So we look at units or wards and clinics and departments and maybe even campuses or different cities that we have facilities located. We also group a lot of times by patient conditions. So type 1 diabetes or dialysis patients. We have so many different chronic conditions. We have so many different acute conditions. We have a lot of different specialty centers and things like that, where we really look at measures grouped by the patient's condition. as Marianne mentioned again, our quality excellence domains, we have a lot of quality excellence initiatives. So different divisions and things may be working on similar measures that we're looking across the hospital. So readmission or decreasing length of stay, looking at patient and family experience. A lot of times we implement the same instruments to gather feedback across the hospital system. We also look at operations sometimes. And I know people get a little worried when in a quality improvement talk, you hear operations, but I like to consider them siblings. So it's always important to know what's going on. The work is so closely related. And another thing that it allows you to do is not recreate something. You don't want to create a state where there's data shopping. So if the QI team is asked about how many visits have we seen in clinic, and you get a different number than what the business department reports, that makes a long day for everyone. So again, it also helps not create rework. All right, I'm gonna try to click, and if not, I'll get you too, Sherry. Okay, so again, here's a report, and it looks like an Excel sheet. Fortunately, this one's automated, but it gets kicked out every month, and it's the same report that's been used forever. It's not extremely intuitive. There's numerous reports that look about like this, right? You just kind of learn how to use them. This particular one has 20 different tabs of data information. So I'm sure over time it didn't start like that, but people would say, well, what about by specialty? Well, what about by this location? Well, what about by this encounter type? So it grew into 20 pages, and to onboard someone to be able to use and find the information that they need from this would be a real pain. You'll click again, Sherry. So sometimes we will color code it. So it might help a little bit. It can help draw attention. But again, if I'm trying to combine the data in a different way, it's not going to get me there. So what we've done as part of our digital transformation, if you'll click, Sherry, is we've taken the opportunity to move this data. So this is the same data. And I found out that they've just moved it into Power BI, into this new template that we've shared. So again, this wasn't created by my team, but it looks very familiar because of sharing that template and providing that for people to use so they don't have to start from scratch. We have a number of the drop downs across the top. And so instead of clicking on multiple tabs, you can drop down and you can filter by encounter type. So you can see the purple is office visits. You can easily tell how many green telehealth visits you have. Blue is our primary care. So at a glance, I already have more insights than I probably ever got out of that previous Excel sheet. The other thing we can do here is to click into and go into our specialties and see those. So the ones that I want to get to quickly, I can get to. So I can either, just select one if that's my area of interest, or if I happen to be managing the portfolio for a couple of these, I'm able to multi-select. So again, it's just able to present the data. I mean, we had to send these reports with all of the data because you might want to add it up differently, or you might want to compare against something else. But starting with the visualizations just gives a lot more insights, and we can answer more of those questions and not have to know how to do all of the pivot tables, or if the data, if we can't find the data because it's hidden on some other tab, something like that, it just makes using the data so much easier. All right, let's see what we got. What's next, Sherry? Okay, so as we've talked about, we are definitely not ready to check off the, are we completely managing all of this data? So these are some older visualizations as well. We have gotten pretty far. Even previous versions of visualizations have tried to incorporate brand colors and multiple charts together to compare and different things like that. The bottom left-hand side even has some comparison between races of patients to look at potential gaps in care. And so again, we've gotten a far way, but there's definitely more to do. You can see there's not a control chart in sight. So again, it kind of makes us cry a little bit if we can't find at least one control chart. There's a lot of good data, but again, really trying to make sure that we're getting all of the insights out of it that we can. All right, let's do the next one. So this is getting to looking better. Again, you can tell, as Sherry shared earlier, this is one of our new template ones. I do want to point out here, it's a combination, right? So once you sign on to EasySPC, you're not locked in. You can use any of the other Power BI visualizations as well. So it's not an all or nothing. We absolutely love using control charts, but as you can see here, we have some stacked bar. We have some radar dials over there on the side. So it's a combination of being able to get our insights from our SPC charts and understand, is our system in control? Are we making improvements? And then we also on the side there have some point in time data. So we're looking at how have we done over this last week in administering this screener for different social determinants of health. So it really helps us in our processes that contribute to the outcomes. So again, this is part of our social determinants of health work that is happening. We have a really big focus on equity work. And so we're trying to make sure to dig in and see that. And this was an early test where we selected a handful of divisions and really drilled in and looked at, are they using the appropriate screeners? Are we collecting the information from our patients so that we can help care for them? You can tell there's a couple of different divisions that are shown here, but the coloring is consistent from one to the other. So if someone's looking across them, they would be able to understand what's going on in the charts. Let's see, one sec. So for example, on the bottom left-hand side, it's looking at who of our patients that came in and had screeners are positive. So those are different components that are stacked up in the different colors. You could click in and look at individually, but you can kind of tell that the green, which has to do with financial resources, is an area of concern for some of our patients and families. So again, it really directs us to understand at a more granular level and within a single visualization, right? So we're not having to go everywhere. We're not having to dig through emails to get what was that improvement project going? Where do I need to focus my interventions? You can see in the top right one there, we've had a shift, actually kind of in the right direction. So that's the positivity rate, and we actually saw a shift. As Sherry noted, we've colored some of our special cause rules. So even though there's a point there below the control limit, it's not calling it out quite yet. So I'll show you how we can look at that as well. But again, with the templates, we're able to see that consistency. So people don't have to reorient themselves when they switch between different views. And it really helps us learn from the information that's there and not having to relearn reading the charts and things as well. All right, Sherry. So from that, we tested that out and got a lot of feedback from our partners. And then one of the really neat things that I like about Power BI as a newer visualization and reporting tool is the way we can link it. So again, we have so many different measures and so many different initiatives happening across the hospital that we really want to make sure and take time that we don't redo anything, that we are able to reuse. And so on the right-hand side of this, you can actually see it's the social determinants of health work. Ooh. We jumped. Okay, back one. Thank you. And then on the left-hand side is a newer body of work that we stood up later, the psychosocial screening. So again, it's able to layer on, and we can create some of these landing pages to help with navigation, but we're not losing the work that we've done. Okay, if you'll click one, Sherry. So this is an example of, let's see, which one is it? The endocrinology dashboard. And again, same fit and feel, different information. I really like that we're able to put some of these numbers at the top and just quick and easy, able to get ideas of what's going on. The time slices are really nice at the top right. So again, even thinking back to the ambulatory visit volumes, being able to select the time, the data that you're actually looking at is really helpful, because sometimes you want to focus in and sometimes you really want to understand the system for a longer period of time. Again, this is one of those process measures that we really hope is going to move the outcome. And so right now we're looking at completion rates and those kinds of things. The other thing, oh, okay. The other part is really digging in and using other visuals. So then the three different instruments that we were looking at were the CRAFT and the PHQ-9, and then the social determinants of health screener. So when we focus in on the social determinants of health, it actually goes back to those other pages that we just looked at. So again, it's familiar for the user trying to navigate and use these charts. The designers didn't have to go, and the analysts didn't have to go back in and build all new things. We're able to link between different reports, which is really nice. So they don't have to be maintained in multiple places. And I just really like that we don't have to keep recreating them. I will show you an example of a call out. So Sherry, if you'll click one more time. So this is what the call out box looks like. So when you hover over some of those points, especially the ones in special cause, this one actually is extra special. So there's two different rules that this one actually gets called out for. One, it's outside of the control limits, which is definitely something you want to check out. But then there's also another rule that we still have enabled, 2 out of 3 points near the control limit. So again, there are settings in here where you can enable or disable. You can have them color coded as a different color, or you can have them remain the same color and not call quite as much attention, but the details are still there as you hover over that. So I know we've talked about it a couple of times, and so I definitely wanted to show you what that looked like. But that was definitely a call out there. So again, this is kind of our journey of where we are. Not everything will end up as a control chart, and that is fantastic too, because it's all about the storytelling and where the teams are and what information they need. We have other examples where we have patient lists. So as you're looking through outcomes, say maybe you're looking at the endocrine patients who are able to control their A1C numbers. And so you might want a list of patients who aren't, so that you can do interventions, so you can go back and check, so you can make sure that they have next visits scheduled with clinic, that they have been reached out to, or we're making sure that they're not being admitted inpatient and those kinds of things. So just another level of detail that this type of reporting and visualizations allow you to do, and to do easily and in the same spot. The other thing that this allows us to do is to share data more dynamically. So it isn't waiting on that monthly report to be sent out. And then users are also able to use any of these filters. So to drill into date ranges, to drill into specialties, to drill into a lot of our new dashboards are being built with a number of equity variables. So we saw some examples of race and ethnicity. We're also looking consistently at language of patients and families. And we're looking at payer status as well. So is it a government or a private payer for our US friends, where that's really important. So there's a number of things that we're able to roll out in a standard way. Users can expect a more consistent feel and look to what they're receiving. And I can't say enough how excited I am about being able to reuse a lot of the visualizations and a lot of the measures that go into behind the scenes. So they can be for a QI dashboard, they can be used for a divisional dashboard. It can continue to roll up to executive leaders. And then we also share these out. Our quality excellence domain shares with our board and different things like that. So again, it's not a new measure. We're not always checking to make sure that we're consistently reporting the same numbers, because we're pulling from the same data sets, which is a real advantage to us. And I'm excited to see where we go. All right, I see a question about, can we connect to any data? So that's the nice part. We have a primary data gateway on the back end to our, Sherry had shared a bit about our digital transformation. So we have a data virtualization layer. The software there is Denodo, and we have our Epic EHR databases connected into that. We have our HR database. I believe it's PeopleSoft right now. We have that connected in there so we can get some staffing information. We have financial data that's linked into there. We have a number of databases where we collect information, especially around our quality improvement initiatives. We have some safety databases where we report safety events. We have data from infection control, I think that's pulled in there. So it's really nice for us to try to pull data from the single source, but we also have the option to link in even like to CSV files, because sometimes we'll get list of patients, or we'll have labels for different groupings of clinics and things like that. So the short answer is we can connect into a number of things, fortunately. So a lot of API connections on the back end of Power BI. And so it makes it really easy to get different data into the visualizations and can be joined there. Power BI has some pretty neat data manipulation features inside it as well. All right, I think that's it.
Excellent.
Thank you.
Thank you so much for that, Sherry, Blair, and Marianne. So as we mentioned at the beginning, please do, if you've got any questions for Blair, Sherry, and the team. Oh, I can see a hand up as I speak. But do put them in the chat or put your hand up, as Zainab has now. Zainab, I'm not sure if you can unmute your mic or if we have to do that for you. If you'd like to ask
Hey.
your question, that'd be great.
Can you hear me?
Yeah, we can hear you. Thank you.
Yeah, I'd like to ask the team, how mature was Synapti's use of Power BI when you started using SPC, EasySPC?
Not at all. Very infancy. And they are, the visualizations that we've already created are extremely helpful and they're beautiful in their own right. But there's a lot of variation. You saw that already, right? And they're learning their way into it. And the learning curve that they've overcome as quickly as they have has been like fantastic. I told you earlier, like I used to think I was smart, not so much. Like when you work with these data scientists and you hand them something, they just pick it up like you would not believe. So they were not familiar with Power BI's visualization tool. There was little to no exposure to it. And it's just been kind of a playground, these initial reports, and trying it on and getting a feel for it. So I expect we'll continue to grow and mature and refine those skills. Blair, I'm let you add to that.
Yeah, exactly. I mean, we learned them together, so that was a lot of fun.
But for your board report at the pack, can you add commentary to SPC chart?
Comments?
Yes.
Go ahead, Blair. Go ahead.
Yeah, there's an annotation feature. I think it was featured on one of the slides that Sherry's
It's really tiny.
shared, but it's the nicest annotation that I've seen happen. You click on it and a comment box pops up and you're able to put your text in there, and then it hides it. It's like a little word bubble, so it doesn't take over the screen when you zoom back out, but it says there's something here to look. So it looks like there's a little comment bubble.
Excellent.
And it's in the call out as well. Like whatever annotation that you add to that data point will be in your call out that will present itself when you hover over the data point.
Yeah,
Thank
and just
you.
sorry, Zainab. Thank you for your questions there. I was just going to quickly add to that as well. A great question, and a lot of our customers in the NHS as well. They really like that because for report packs and board packs, the execs like to see the commentary on the chart itself. So it's proved to be a really useful tool because you can export it to PowerPoint and PDF as well, as standard with Power BI too. So thank you for that, Zainab. There have been a couple more questions in the chat, so thank you for them. I'll read them out unless Dominic, you did want to ask that in person, then you can. But the question is,
go ahead.
Have you had any issues with the other data providers trying to get you to use their reporting platform rather than just providing access for Power BI?
I personally have not. No. Have you, Blair?
So I think it's always part of that change management, right? So if what they have, quote unquote, works better, then that's a really hard conversation. But trying to figure out a way that what we're trying. Go ahead, Dominic.
Yeah, sorry, I couldn't find my unmute button.
No, you're good.
So just to give some context, so we're going through much the same process now. We're moving across to SPC, and we're trying to combine all our separate data streams into one version of the truth. But what we found is that especially some of the bigger companies just want us to use their reporting platform and often want to charge sizable fees to get just the access to rather, which makes it awkward. So we're having to sort of do workarounds with using automation and Power Automate, which is not ideal and adds a lot more complexity than possible. And I just wondered if you'd experienced the same sort of thing, obviously, because I think you're probably a sizably bigger organization than we are.
Yeah. So we actually we just recently, I mean, I don't know if this is helpful because the problem is the access, right? You don't have access to the actual data behind the visualizations that provider is giving you. And with our patient family experience survey data, we had a similar issue, and for many years they would send that data over to us, but it was kind of in piecemeal. And so the visualizations we were able to stand up, and at the pace that we would prefer to do that, we couldn't really accomplish it. But recently they did come to an agreement as far as a data use agreement, and we've stood up our own SQL database and have an electronic data transfer set up to push that information over. It's not real time, but it's near real time. We get an update, I think, on a daily basis. It's overnight. So I would say our solution was negotiation. You gotta send in a closer like me. You gotta send me in. I didn't do this. I didn't procure this deal, but really it was just a matter of access, and do we have access to that data, and how can we get that access, and coming to a mutual agreement.
Thanks.
Yeah, for quite some time, we would go into the system and do a manual download. And
Yeah.
I think with bandwidth, we would do that regularly, about once a month, but it was kind of iffy at that.
Yeah, great question, Dom. Sorry, I'm just going to add to that there as well. We've had some customers in the NHS who, for instance, with ESR data, that they've not been able to get access to it quite as easy as they'd like to. So there are solutions to that using Azure Data Services. And I don't know if you're all aware of Fabric, which is sort of new to Power BI 2, can help with some of that. System One being another we've worked with in the NHS. So there are ways to get around some of these things. Sometimes it is keep knocking on their door, but other times you can use technology to help with that and assist with that as well. Thanks for the question, Dominic. So Tom has asked, when using your time slicer, which you must have seen in your screenshots there, does the SPC chart dynamically update so people can see different periods on demand?
It does. That's one of my favorite new features. Because again, sometimes people want to look at calendar year, and sometimes they want to look at fiscal year, and sometimes they're trying to take snapshots for publications, and sometimes they're trying to do it for end of year review, and sometimes they're trying to show how we're using SPC charts for regulatory requirements, or a whole myriad of different, presentations at IHI or something like that. So being able to dynamically set what that time frame is another really nice feature. Again, it's not a complete showstopper, but it's really something nice to have, right? Not a have to have, but a nice to have.
Excellent. Well, thank you so much for those questions. I'm conscious Marianne didn't get a question then, and I did note one down. So I'll ask you a question, Marianne. So in your slides, I think you were talking about the sort of the team and the department you have from a quality improvement perspective. Are you able to share a little bit more about the types of roles that are part of that team?
Yeah, absolutely.
Okay.
Thanks, Oliver. So on my team, we have the project management staff. So those are project managers and project specialists. And then on the quality improvement professional side, we have clinical quality specialists. So those folks have a clinical background. And then we have quality improvement specialists. And a lot of those do not. So engineers like me who do QI work. And then I can let Blair and Sherry speak to the types of roles that they have on their teams.
Sure. So I have the data science team. We change the name every so often just to keep it snazzy, I think. We've been decision support analyst and data analyst, and right now we're data scientists. And it's really helping understand what we're doing with improvement. So using the data and finding insights out of it, really digging in with the team, understanding their requirements, getting with the evidence methodology team and the evidence the clinical teams have, potentially guidelines or bundles or whatever they're trying to implement or measure, and figure out if we have data for that. And if not, what data do we need to collect to be able to measure and find improvements. So It's a really fun team.
It is a fun team. They're so smart.
Thank you for that.
So my team is forming. We have a team of data specialists that help with the data management and organization of the data. That team is pretty well established. We had a small group that was responsible and helped support the data analysts, data scientists, Team Genius. They've been in place for several years. We're recently got the funding and approval for a BI analyst team. So we're creating and recruiting anyone out there. We're recruiting for BI analysts to help. These are new tools for us. So this is a Power BI and Power Platform, Power Apps. We're going to be using Power Apps pretty heavily in our operational solutions. We're going to do a little sneak peek next week with regards to those things. And so that team, we're going to bring them on board to help really manage those tools, help establish what some of the best practices in the use of those tools, publishing standards, holding ourselves accountable to those charting standards and visualization standards that we identify, and then really helping with the infrastructure as well. That Denodo, the data virtualization tool that we have, Denodo is also a new tool because we just like a challenge here at Cincinnati Children's. Like we just like to disrupt things. So we're going to have some folks come in that can really help manage those data assets and promote those data assets. So that's my team.
Excellent. Thank you so much for that. Oh, I think there's a. Oh, yep. Don't agree. Sorry, just reading your comment there. What I will add to that is I'm just putting a link into the chat now for anyone who's not already aware. EasySPC is a custom visual in Power BI, as Sherry and the team mentioned. There is a free version, so please go ahead, download that. It's completely free. You can play around with that tool, bring your data into Power BI, into EasySPC, see how that plots your data. So yeah, have a go with that. I'd encourage you. And just before we let you go, Sherry, I know you mentioned next week's episode. We're going to talk a little bit about the Power Platform, is it?
Episode, that's cute.
Episode, yeah. We'll be on TV soon.
I could have a virtual TV show, honestly. You could be a fly on my wall at my house. But next week, we are standing up. So the Anderson Center, our bread and butter, and what we do, we are in service of the quality improvement work that is happening across the organization. And management of that can be a lot challenging. We've already demonstrated that. So right now we're kind of in playground mode with a lot of these visualizations and reports that we're creating. And we have operationally a solution in the management of QI work in particular, and how our resources will really leverage these tools in support of the quality improvement work and the teams that we are really helped to drive these improvements with. And we're going to show you what we're doing with this Power Platform as a whole. It's not just Power BI. So Power BI is what the consumers look at. That's the deliverable. It's the final output. We're going to be leveraging also Power Apps, Power Automate, Dataverse. We're going to be using a lot of the tools in that whole toolkit. And we're going to be showcasing that solution next week. And I'm so excited about it. I can't wait. So.
Excellent. Thank you so much for that, Sherry. And it just to bring us back around to the beginning of the webinar then, so we did put that poll in the chat as well, just asking the question around the strategic direction of your organization when it comes to quality improvement. And it looks like we've got some really positive responses there, I think. More than 50% agree, and most of those strongly agree. And no one strongly disagrees. So I think that's a positive in regards to where the healthcare organisations are going into in terms of quality improvement there as well. So that's great to see. And yeah, thank you so much again for all your time today, for both presenters and you guys who have attended. And we will see you next week, where I may even have another poem. You never know. Thank you.
I insist you actually speak the poem next.
Oh, no. We'd get from leaving the call straight away if we did that.
Right.
Thanks, everyone. Bye.